Hello guys, today you're welcome to my channel again where we'll be discussing a number of issues regarding fibromyalgia. Today is an important topic in which we hope to be sharing potentially valuable pieces of information with the family and friends of patients with fibromyalgia. And I'm also quite sure that a significant proportion of what we'll be discussing will be useful for the patient as well. So we're going to jump right into it, and we're going to start by describing what is fibromyalgia in few words. Fibromyalgia is a widespread pain disorder that is characterized by a lot of non-specific manifestations in addition to the core symptoms, which is primarily pain. Now, pain in a widespread distribution is the mainstay primary problem in fibromyalgia. And when we say widespread in this context, we refer to if you divide the body into four equal parts, with one line running through the middle vertically, another line running through the navel horizontally. These four parts will all have pain. Now, the pain could be more dominant in one area than the other, but it will be present in essentially all areas. And this is a gross description of widespread pain, but that's not all. It's also believed that widespread pain will also involve the exoskeleton. The exoskeleton is the part of our bony structure that lies within the neck area down to our pelvis. So the whole of the spine and the chest bone, they all form part of the exoskeleton. So typically a person that is having widespread pain could be reporting pain in all of these four quadrants, and in addition to that could also have back pain. That's a very simple example of what widespread pain is. So how real is fibromyalgia? This is an age-long question that has been asked over and over and over again. And it always keeps coming up because all too often the patient feels as if people don't believe them or people don't think they have a real disease. Well, let's start by me simply providing the simple answer: fibromyalgia is real. Now, we might not have a straightforward diagnostic test to say positive or negative, but that does not make the reality of the disease any less. In fact, this condition is well classified in the DSM classification of diseases, which is the standard record of disease classifications that all physicians use the world over. And this is based on established parameters by which the condition is recognizable. In any case, there are ample evidences that reinforce the reality of fibromyalgia. For decades, we now know that the central nervous system behaves in a different way in people with fibromyalgia. Now, from evidences from functional MRI, in which the nervous tissue has been studied in people with fibromyalgia as compared to the general public, it has been observed that certain regions of the brain and the central nervous system that are responsible for perception of pain seem to be overactive. This is a major problem in fibromyalgia because, in essence, it does mean that people pick up pain from things that should not cause them pain. Apart from the evidence provided by the functional MRI and other imaging of the central nervous system, there is also a lot of evidence that came from the neurotransmitters. These are chemicals that are present within the central nervous system. Neurotransmitters are chemicals that help us transmit impulses across nerves. So typically, nerves are not directly linked. There is a space in between them called synapse. And across these spaces, to communicate information, to transmit signals, then there are measures, sometimes involving electrolytes, and other times involving various components, including neurotransmitters. It requires neurotransmitters to determine whether a nerve will be sending signals that says activate or deactivate. And for this reason, some neurotransmitters are described as inhibitory and other ones as stimulatory neurotransmitters. Now, when we refer to the central nervous system, meaning the part of the nervous system in the brain and the spinal cord, there is a mixture, a good balance of inhibitory and stimulatory neurotransmitters doing various jobs, because signals cannot be allowed to keep going on endlessly. There tends to be other mechanisms by which these signals are counteracted in inhibitory mechanisms. This is what helps the system achieve the balance. Unfortunately, in the nervous systems leading to the correct interpretation and identification of pain, sometimes there will be an excess of stimulatory neurotransmitters and neuroactivities. meaning that there is central sensitization, excessive sensitivity of the nervous tissues to the perception of pain. This is exactly what is happening among patients with fibromyalgia and similar diseases. So the core symptoms of fibromyalgia include first and foremost the widespread pain. By definition, widespread pain is the primary problem in fibromyalgia. But this widespread pain needs to be better understood in a different perspective. And I'll give some of the manifestations of it that could help us understand it better. There is a component of it called allodynia, which refers to the perception of pain from things that should not cause pain. Imagine if somebody shakes your hand, normally like someone should shake your hand, and you feel a lot of pain from just that contact. That will be considered abnormal, even by everyday regular standard. That is what allodynia refers to. Things that should probably just give you a sensation of contact and nothing more than contact, giving you a sensation of excruciating pain. That is allodynia. When the brass strap is so painful that the wearer of it cannot bear it and they have to remove their bra, that is usually allodynia. When the patient with fibromyalgia is at home and they find their own clothing uncomfortable, causing them a lot of pain, that's frequently due to allodynia. You can imagine if a patient goes outside and wind blows on their skin and causes them so much discomfort. All too often, that could well be from allodynia. An example is a kid hugs you. Just by hugging you, you feel profound pain from the contact. It may very well be allodynia. So that's one component of it. Another one is hyperalgesia. Hyperalgesia means things that should normally cause some pain now cause exaggerated amount of pain. So a tiny pinprick, maybe we should not even go to something as far as tiny pinprick. Pressure from somebody else's finger, that probably should just give you tiny pain, discomfort, that gives enormous excruciating pain. That will be hyperalgesia, too much, excessive, exaggerated sense of perception of pain. And then there's also dysesthesia. Dysesthesia refers to the abnormal perception of pain, meaning the sensation is not just pain here, actually, the perception of abnormal sensation. So it is very common for patients to report pins and needle sensations in their hands and their legs under normal circumstances, where they do not have any nerve damage, where there is no injury, when there is no burning. Patients can report their hand or their feet is feeling cold or hot, or they are always feeling like they are burning from the inside. Unpleasant sensations, that's what dysesthesia refers to. All of these are commonly found among patients with fibromyalgia, and it is hard for them to oftentimes put into words. So these patients are feeling things that they cannot always adequately communicate to people who are looking at them. And this all too often makes them look as if they are faking it or difficult to be believed. Widespread pain is the first core symptom we are discussing. The next one is fatigue. It's an extremely common component of fibromyalgia. Up to 90% of patients will have profound fatigue. In fact, as we well know, chronic fatigue syndrome, otherwise called myalgic encephalomyalgia, can coexist with fibromyalgia. This other condition can be a primary disorder of profound fatigue. So when a patient is reporting feeling exhausted all day and every single time, feeling tired and waking up not feeling refreshed, these are common components of it. Again, the feeling of unrefreshing sleep, when patients wake up in the morning and it is as if they did not sleep all night. Some patients have been known to come to the doctor and describe feeling as if they were beaten in the middle of their sleep. This is the kind of feeling patients with fibromyalgia can experience, and this is also a part of the core symptoms of fibromyalgia. Cognitive problems refer to patients' struggle to concentrate and memory challenges. So, patients might be losing their train of thoughts in the middle of a sentence. Patient could struggle to remember basic things. Patient can be stressed because their brain seems to be overwhelmed by so many things, and that seems to be like a clouding of sensation. Their memory, their concentration is no longer as sharp as it used to be. It's a common component of fibromyalgia, and this forms part of the core manifestations. Now to the associated symptoms of fibromyalgia. Now these refer to what is commonly called somatic symptoms, the other bodily manifestations that are not always straightforward, directly explained by the core manifestations of fibromyalgia. And there's a lot of these ones. There are so many that can make the presentation and the symptoms being reported by the patient sound or appear bizarre. In fact, this is probably one of the reasons why patients don't feel as if people understand them or trust them. And I'll give you some of the examples. A lot of pain, headache or migraine, dryness in the eyes, dry mouth, sometimes mouth ulcers, ringing in the ears, problem with circulation, including outright Raynaud's phenomenon with color changes going white when exposed to cold, wheals and other forms of rash on the skin. Irritable bowel syndrome is extremely common with fibromyalgia. So patients could report bloating, vomiting, nausea, diarrhea, a lot of abdominal discomfort, and heartburn. In addition to all these, patients can also report pain while micturating, spasms in their bladder, and incessant micturition. These long lists of somatic symptoms can make it so difficult for the patient to cope and struggle. And these are among the aspects of the condition that are not very well understood. So what are the challenges the patient faces the most? Number one is that the world around them does not seem to understand what they are going through. This can be very frustrating for the patient. All too often, they have the feeling that people think they are lying or they are just lazy. This is not the case. Fibromyalgia is a condition that wipes out patients' energy. And waking up in the morning, struggling to have your shower can be a lot of work. Sometimes patients feel drained just after managing to complete that. A patient with fibromyalgia could promise themselves they are going to do the dishes, and after packing a few plates, they get drained. This can be very difficult. Another challenge is sensory overload. This refers to the feeling of exhaustion in terms of mental processing of things. I'll give you an example. What could be considered as just background noise to the average person whose brain will be able to dampen the effect of that signal and not concentrate on it cannot be easily ignored by the patient with fibromyalgia. So a little nuisance noise on one side and somebody else talking to them and the signal being persistently sent by pain here and there in their body can all be so overwhelming that they get this sensory overload, and additional stimulus of any form can make it even more and more difficult for them to cope. This tends to generate a lot of stress among patients. Particular problem patients experience with their relatives is what is described as high expressed emotions. When the caregivers or friends and family of the patient always have something to say about their condition and expressing potentially negative sounding opinions about how the patient is coping or how they are doing or their approach to their illness can be potentially overwhelming for the patients. These high expressed emotions can make it seem like patient has given up on themselves, and this is again discouraging for a patient who has a condition that is all too often associated with depression and other times anxiety. Lastly, I'll talk about the challenges that can come with the absence of support group or the presence of the wrong one that does not help them much. All too often, the patient can find themselves in a support group where things are not well moderated and they pick up a lot of incorrect information and they end up sharing more anxieties from other people and develop a wrong perception about what their illness should be. This doesn't help. And when the patient also feels isolated and does not get help, this can be very difficult for the patient. So what can friends and family do to help the patient? Number one is to support them and do not negatively criticize them. When you criticize the patient all too often, this is going to make their mental health even worse. This will not help them cope better but make them feel worse. You cannot generate motivation in the patient who is dealing with pain by constantly nagging them and making them feel lazy or too unserious to take responsibility for their lives. So, as such, curbing high expressed emotion will be very important in this aspect. It's also important to explain that the feeling of fibromyalgia is actually a lot worse than it looks. So from the point of view of this person that is not the sufferer of the condition, it may seem as if there is no visible disability, whereas a lot is going on the inside. There are many times when patients with fibromyalgia have been asked to paint a picture of what they are feeling like. I can assure you many of these pictures are very ugly to see. However, family and friends can be helpful in helping them cope better in a number of ways. You could encourage them in participating in things that have been proven to help in different circumstances. Generally speaking, it takes a combination of some pharmacological agents such as drugs and non-pharmacological agents such as exercise and other supportive activities for the average patient to manage their symptoms. Encouraging them and supporting them when they need to participate in things such as yoga, Pilates, Tai Chi could be helpful. Patient could be helped by helping them remember things they forgot. A patient is preparing for their clinic, we could help them make a list of things they need to take with them or remind them of things they had planned to take with them. So helping them remember things could be of benefit to them and help them deal with some of the mental loads they are handling. For in conclusion, fibromyalgia is a very complex disease that is characterized by widespread pain and it is very often misunderstood by the relatives of the patient. And if people around the patient understand it a little bit better, they might be able to tolerate the patient better and offer more support and hopefully help the patient cope better. If you find this discussion helpful, kindly subscribe to my channel and like this video. Thank you.